Are you or a loved one struggling with the daily challenges of eosinophilic esophagitis, or EOE? The constant difficulty swallowing, pain, and fear of food getting stuck can be incredibly disruptive. Today, we're going to explore Eohilia, a new medication offering hope for improving these symptoms and helping you regain control over your life. Eohilia, pronounced Eohilia, is the brand name for oral budesonide. It's an oral suspension, meaning it's a liquid medicine you swallow. This medication belongs to a class of drugs called glucocorticoids, which are powerful anti-inflammatory agents. Eohilia is specifically designed to treat eosinophilic esophagitis in patients aged 11 years and older. It works by reducing the inflammation in your esophagus, which is the food pipe connecting your throat to your stomach. Eosinophilic esophagitis is a chronic inflammatory disease. It occurs when a type of white blood cell, called eosinophils, builds up in the lining of your esophagus. This buildup causes inflammation and damage. Symptoms of EOE often include difficulty swallowing, dysphagia, vomiting, and pain. If left untreated, this inflammation can lead to narrowing of the esophagus, making it even harder to swallow and causing food to become stuck. Eohilia contains budesonide, a corticosteroid. When you swallow Eohilia, it directly delivers this anti-inflammatory medicine to the inflamed lining of your esophagus. This targeted action helps to reduce the number of eosinophils and calm the inflammation. A unique feature of Eohilia is its consistency. It flows freely when shaken but then returns to a thicker state when swallowed. This helps the medication coat the esophagus effectively, maximizing its contact with the inflamed areas. Eohilia received FDA approval on February 9, 2024, specifically for patients 11 years of age and older with EOE. It's important to note that Eohilia has not been shown to be safe and effective for treatment lasting longer than 12 weeks. Your healthcare provider will determine the appropriate duration for your treatment. Like all medications, Eohilia can cause side effects. It's crucial to be aware of these and discuss any concerns with your healthcare provider. Some of the more common side effects, affecting 2% or more of patients, include respiratory tract infections, fungal infections of the mouth, throat, and esophagus, and headaches. Other common effects are stomach and intestinal infections, throat irritation, adrenal suppression, and acid-related damage to the esophageal lining. Long-term use of Eohilia can lead to elevated levels of corticosteroid in your blood, a condition called hypercorticism. Watch for signs like acne, increased body or facial hair, ankle swelling, easy bruising, or a fatty pad between your shoulders, buffalo hump. Rounding of your face and pink or purple stretch marks on your skin are also possible indicators. Eohilia can also cause adrenal suppression, where your adrenal glands don't produce enough steroid hormones. Symptoms include tiredness, nausea, vomiting, weakness, or low blood pressure. It's especially important to tell your healthcare provider if you are under stress or planning surgery, as this condition can be exacerbated. Corticosteroids, including Eohilia, can weaken your immune system, increasing your risk of infections. These can be caused by viruses, bacteria, fungi, protozoans, or parasites. Eohilia can also worsen existing infections, cause them to spread, or reactivate dormant infections. These infections can range from mild to severe, and in rare cases, can be life-threatening. Your healthcare provider will monitor you closely for signs of infection. Report any new or worsening symptoms immediately, such as fever, cough, chills, pain, abdominal pain, fatigue, aches, nausea, vomiting, or diarrhea. If you have inactive tuberculosis, Eohilia might cause it to become active. Your doctor will monitor you for this. People who haven't had chickenpox or measles should avoid contact with infected individuals while taking Eohilia. If you are a carrier of hepatitis B virus, HBV, Eohilia could reactivate it. Your doctor will test you for HBV before starting treatment. Similarly, inactive amoebiasis might become active. Your doctor should check for this if you've traveled to tropical areas or have unexplained diarrhea. Fungal infections of the mouth, throat, and esophagus are a known side effect. Look for white spots in your mouth, a burning or painful sensation, redness, difficulty eating or swallowing, loss of taste, or a cotton feeling in your mouth. Report these symptoms to your doctor. Eohilia can cause acid-related damage to the lining of the esophagus. Report any new or worsening heartburn, chest pain, or trouble swallowing. For children, corticosteroids can affect growth. Your healthcare provider will monitor your child's growth if they are taking Eohilia. If you switch from other corticosteroid allergy medications to Eohilia, your allergies, like eczema or rhinitis, might return or worsen. Kaposi's sarcoma, a type of cancer, has been reported in people on long-term corticosteroid therapy. Discuss any new or concerning symptoms with your doctor. You should not take Eohilia if you are allergic to budesonide, its active ingredient. Always inform your healthcare provider about all your medical conditions before starting Eohilia. Before starting Eohilia, tell your healthcare provider if you have liver problems or are planning surgery. Inform them if you've been near anyone with chickenpox or measles. Disclose any untreated infections, including fungal, bacterial, viral, parasitic, like threadworm or ocular herpes simplex. Also, mention if you have or had tuberculosis, cerebral malaria, or an infection of the mouth, throat, or esophagus. Discuss any history of diabetes, glaucoma, or family history, cataracts, high blood pressure, low bone mineral density, osteoporosis, or stomach ulcers. If you are pregnant or plan to become pregnant, tell your healthcare provider. Eohilia may harm your unborn baby. Discuss the potential risks and benefits. If you become pregnant while on Eohilia, contact your doctor immediately. If you are breastfeeding or plan to breastfeed, inform your doctor. It's unknown if Eohilia passes into breast milk or affects your baby. Your doctor can help you decide the best way to feed your baby. Eohilia is taken by mouth, twice a day, once in the morning and once in the evening. It comes in single-dose stick packs containing 2 mg of the oral suspension. Important instructions. Do not mix Eohilia with food or other liquids. Shake the stick pack for at least 10 seconds before opening. Squeeze the entire contents of the stick pack directly into your mouth, repeating 2 to 3 times until empty. Swallow all the Eohilia suspension. Do not eat or drink for at least 30 minutes after taking the medicine. After 30 minutes, rinse your mouth thoroughly with water and spit it out. Do not swallow the rinse water. Avoid consuming grapefruit juice throughout your treatment with Eohilia. Always take Eohilia exactly as prescribed by your healthcare provider. Do not change your dose or stop taking the medicine without their guidance. As mentioned, avoid drinking grapefruit juice. Grapefruit juice can significantly increase the level of budesonide in your blood, potentially leading to more side effects. Also, inform your doctor about all your other medications, including prescription and over-the-counter drugs, vitamins, and herbal products. Certain medications, known as CYP3A4 inhibitors, like ketoconazole, itraconazole, ritonavir, erythromycin, and cyclosporin, can also increase budesonide levels in your body. Your doctor will review your medications to prevent harmful interactions. Store Eohilia between 36 degrees Fahrenheit to 77 degrees Fahrenheit, 2 degrees Celsius to 25 degrees Celsius. It can be refrigerated but do not freeze it. Eohilia's active ingredient is budesonide. It contains various inactive ingredients, including cherry flavoring, and is free from gluten-containing grains. Eohilia is distributed by Takeda Pharmaceuticals America Incorporated.